Polycystic ovarian syndrome, or PCOS, is actually a diagnosis where patients typically do not go ahead and ovulate efficiently.
PCOS is a problem that a woman is born with. Initially, it may cause her problems around the time of puberty because she may not get her menstrual periods. Or if she gets menstrual periods, they may be irregular. And then commonly young women, girls with PCOS, will have problems with severe acne. They may also start having facial hair. These are cosmetic issues, but they're very distressing, especially to young teenage girls. Then the problem evolves into a fertility issue. They may have problems achieving pregnancy. Next stage in life is going to be when they are a little bit older. They're going to have an increased risk for diabetes, an increased risk for high blood pressure. So that's sort of the next phase. And then the final phase is as women approach menopause, they have an increased risk of endometrial cancer. There are, as well as having the problem frequently of increased risk of heart disease.
Ovulation is a key component to patients going ahead and getting pregnant. It's literally that smack dab in the middle piece of the female menstrual cycle. And so when patients don't ovulate, they don't have a likelihood of going ahead and getting pregnant. And when we talk about ovulation, it's really the last stage of maturation for the egg. It's also what we call a luteinizing hormone surge, which is what you can go ahead and detect on an actual ovulation predictor kit, as well as then the release of the egg from the ovary into the fallopian tube. And so if those things are not happening, it makes it much more difficult for us as women to go ahead and actually get pregnant.
In 2010, we started what I call the LIFE program for PCOS. I think that it's something that should be treated as early as possible because there are very simple treatments that we can use when a woman is very young. Teenagers can be educated about diet because diet plays a major role in PCOS. We can educate them about weight control. Weight plays a major role in PCOS. Frequently, a treatment that works extremely well to take care of their problems is birth control pills. It regulates their menstrual periods so they don't have the abnormalities with the menstrual periods. It frequently abolishes acne and helps prevent the abnormal hair growth. And so there are things that we can do to help prevent a lot of the side effects of PCOS.